just an extension of technology. So that makes me feel very, very proud. And all I can say is congratulations to the whole team. They have done a wonderful job, and I hope you continue doing that and you grow from strength to strength. And I wish you well. Thank you.
Thank you so much, Dr. We appreciate your time and sacrifice so far, and just your journey, making it clear that you have seen CHS grow from strength to strength, and the journey still continues on. Thank you so much. Let's just appreciate him once again. Thank you so much indeed. All right, for now, we have another guest as well, joining us via Zoom as well. Through specific projects in 435 facilities across 7 counties, CHS, with support from CDC, implements and expands high-quality HIV prevention, care and treatment services, contributing to the ambitious 95-95-95 targets to help end the HIV/AIDS epidemic by 2030. To get an in-depth understanding of this and more, please welcome CDC Kenya Country Director, Dr. Mark Balteries. Dr. Mark. Dr. Mark is also joining us via Zoom.
Good morning, everyone. I hope you're able to hear me.
Yes, we can hear you, Dr. Mark. Go ahead.
Okay. Thank you very much. Thank you for inviting me to attend and to give brief remarks. All protocol observed. Congratulations, Hongera Sana, CRS. Please all keep safe as we are now in the wave of COVID-19 in Nairobi. So the CDC in Kenya has been here for the last 40 years doing randomized clinical trials in malaria, HIV/TB, and other disease areas, and also working very closely with the Ministry of Health and with other partners, strengthening local capacity to prevent, detect, and respond to disease threats, especially HIV/AIDS, emerging infectious diseases, influenza, TB, malaria, and some other areas. We also have an office for refugee and migrant health that is actually a regional African office that's based here in Nairobi. CDC Kenya also helps other countries here across Africa and across the world. In partnership with KEMRI, Ministry of Health and others, we have conducted research on the effectiveness of new interventions and by preventing disease, reducing death and disability, and implementing evidence-based public health programs. Additionally, CDC training programs, often implemented through the ECHO program, have improved public health workforce skills in areas such as laboratory, epidemiology, and management sciences. CDC has been fortunate to have a long-standing collaboration with CHS here in Kenya, dating back to 2011, so 10 years ago, when your organization was first started. Back in 2011, CHS received funding from CDC to support HIV care and treatment in the central region of Kenya. As we now celebrate 10 years, we join you also in celebrating 10 years of partnership between our two organizations. CHS remains a highly valued member or a partner to CDC. And as a testament to this, from the initial scope of Central Kenya 10 years ago, CDC now supports to implement HIV treatment and care programs in Central, Eastern, and Nyanza region. To support this work, in the last 10 years, CDC Kenya has provided a total of over $144 million in direct funding to CHS Kenya. This funding has resulted in the impactful work you have all been able to provide and continue to do among persons living with HIV, work that we are also very proud of at CDC Kenya. Currently, your organization supports 178,479 persons living with HIV on treatment. This constitutes 24% of the HIV portfolio that CDC Kenya is directly supporting, with a scope that has now expanded also to include key population programs, a very important area if we want to reach goals of UNAIDS and of course the government of Kenya here. In line with these goals, PEPFAR's goals, CHS continues to support a high quality HIV program. Of all the persons that are under CHS support, persons living with HIV, 96% have achieved viral suppression. In the journey toward elimination of mother-to-child transmission of HIV, CHS has made commendable progress with a transmission rate of
Beg your pardon, Dr. Mark, we missed part of your last remarks there.
Okay, I think
Yes,
I
go ahead.
somehow went on mute. Apologize for that.
That's all right.
But I'll repeat that CHS currently supports 178,479 persons living with HIV on treatment. 4% of the entire CDC Kenya recently has expanded also to include key population programs. So in line with CDC and PEPFAR's goals as well as the government of Kenya, CHS continues to support implementation of high quality HIV programs. Of those persons living with HIV, 96% have achieved viral suppression, which is a truly remarkable result. In the journey toward elimination of mother-to-child transmission of HIV, CHS is also making commendable progress towards reaching a very low transmission rate, currently at 3%, below the 5% threshold of WHO and UNAIDS, and substantially lower also than the average mother-to-child transmission rate in Kenya. As you all know, we are currently facing an unprecedented challenge with the COVID-19 pandemic. Here in Nairobi, we are currently in the third wave. As you might have seen in the news, 17 people died yesterday of COVID, and 140 people are currently in ICU beds. The numbers are still going up, and PCR positivity is around 17%, very, very high. CDC continues to partner with the Ministry of Health to mitigate the impact of COVID-19. We are supporting testing, isolation centers, as well as the National Emergency Response Coordination and technical support in the response. At the county level, CDC is supporting County Emergency Response Coordination, and CHS, together with our implementing partners, remain a very important link in supporting this response at the county level. Thank you for that. Please also, everyone, keep safe and healthy, masked and distanced. As I close, we are very proud of the growth CHS has achieved over the last 10 years as an indigenous non-government organization, demonstrating to implement really high quality programs. As opportunities arise, we look forward to continued partnership with CRS here in Kenya. Thank you for all that you do and wish you a very good celebration. Over to you.
Thank you so much, Dr. Mark Alteris. We appreciate you. Thank you so much for your sentiments, for your time. Wow, CHS remains a highly valued partner to CDC Kenya. CHS has made commendable progress in offering high-quality HIV programs among its key projects. And of course, a clarion call to all of us to keep safe and healthy. We'll move on to another very critical partner as well. With the support of United States Agency for International Development, USAID, and in collaboration with the National Tuberculosis, Leprosy and Lung Disease Program, CHS implements the Tuberculosis Accelerated Response and Care 2, a 5-year activity targeted at reducing the incidence and TB-related morbidity and mortality in Kenya by improving TB case findings, improving access to high-quality, patient-centered services, and enhanced accelerated research and innovation. Of course, to appreciate the work that has been done so far, please welcome USAID Kenya Tuberculosis Team Lead, Health, Population and Nutrition Office, Dr. Morris Maina. Dr. Morris Maina, welcome. Also via Zoom, Dr. Morris, we're eagerly waiting to hear from you.
Good morning, can you hear me?
Absolutely, good morning. Karibu sana.
Asante. Good morning you all. I hope you are all keeping safe and well. As you heard, Morris Maina from USAID, thank you for inviting me to make remarks on this day. It's a great day for CHS, for us. Congratulations to Centers for Health Solutions for having grown for 10 years. We've seen this growth since inception to now, and it's not easy for a local organization to grow to 10 years. Many organizations die at 3 years, but due to resilience, rising above challenges, we have seen you grow to where you are today. This is a result of hard work, commitment, and good governance. I would say at this point that it is important that we don't take the successes, the growth for granted, and would like to thank the board of CHS. Through the years, they have provided proper direction, proper governance, ensuring that systems are put in place, and this has helped in the growth of the organization. I would also like to thank the staff of CHS. They have worked with a lot of dedication, commitment. We've seen how they go beyond the regular call of duty to ensure that services are provided across the country. So I'd like to thank you as staff of CHS. Working with government and other partners, especially the National TB Program, we would like to thank the government for collaborating very well with the CHS, both at national level and at the counties, and this has helped and contributed to the successes we've had today, and for a good process where we've seen excellent results produced through the collaboration of working between the national government and the counties. USAID has worked with CHS over 8 years now, and CHS has been our main partner in TB control activities. And we can see the results of TB control in Kenya. I know a few years ago we were missing cases, and CHS through TB project was able to pilot active case finding, and were able to start seeing more than 10% increase in cases notified. I think I would want to commend CHS for ensuring that activities with the National TB Program are well planned, they are collaborative, they are strategic, and they give us the desired results. Being a local organization, USAID would want to encourage CHS and other local organizations that are indigenous. They do provide local solutions, working with local partners and also with local staff. CHS, we've used CHS as a showcase for us moving a lot of our projects as USAID from international partners to local partners. So we want CHS to remain strong, focused, and moving in the direction that we've seen you moving over the years. So, as we move forward, we would like to urge that we focus on collaboration, communication, so that you're able to communicate both your results internally and externally, so that we may showcase that the use of local organizations to provide local solutions is the way to go for many of the programs, both in Kenya and outside of Kenya. As we move forward, we as USAID are focusing on journey to self-reliance that focuses on two things. One is capacity. Capacity is where we want to improve the capacity of counties, national governments, and citizens so that they are able to provide local solutions to local challenges. The second part of this is commitment. We want to build a commitment between local partners, local governments, so that we may have more contributions to local solutions, either budgetary or in some way of resources, so that the solutions that we develop are implemented in a way that is owned and led by the people of Kenya. I would want to wish CHS, as I conclude, all the best as you grow. Keep on moving on the right path. As many say that the journey of 1,000 miles starts with a single step, and now you've made several steps and you're gonna go far. And again, as you go far, walk with the people, don't walk alone, because if you want to go far, it's the people you go with that make you go far. My last comment is I want to remind all of us to keep safe from COVID, continue wearing masks, social distance, and sanitize. And I wish you all the best in your celebrations today and future endeavors as you grow. Thank you, and bye.
Well, thank you so much, Dr. Maina, for your sentiments. We appreciate the fact that USAID Kenya has made CHS its main partner in the fight against TB, and recognizing its resilience, growing above challenges, that has indeed seen CHS celebrate 10 years. And the staff at CHS going beyond the regular call of duty. A big round of applause to the CHS staff. Well done. Going beyond the regular call of duty. And right now we want to celebrate all the partners. A big round of applause to all the partners. We have Kenyans and Americans in partnership to fight HIV and AIDS. Makofi to USAID. And of course CDC. Thank you so much for your support. Indeed, local organizations providing local solutions to local challenges is indeed the true journey to self-resilience. Asanteni sana. Ladies and gentlemen, as we move on to a very critical part of this meeting, guided by a vision of a world of healthy families through universal access to health interventions and services, CHS is a close and trusted partner of the government of Kenya, working in partnership with the national and county governments, donors and other stakeholders for the delivery of sustainable health services. To get an overview of the third CHS strategic plan, please, ladies and gentlemen, I call upon you to welcome this gentleman who has seen this journey start and is still here, going strong, as we celebrate 10 years of service to local communities. A big round of applause to the CHS Chief Executive Director, Dr. Paul Wekesa. Makofi tafadhal. Welcome. Karibu sana. Welcome.
So good morning all. Really a true pleasure to see you here celebrating this 10th anniversary with us. We do not take it for granted that you're physically here and also present online to celebrate with us. My job today is very simple. I'm going to give you a glimpse of what we envision for the next 5 years for the organization. We are proud to have our third strategic plan as CHS, and this gives a glimpse of where we've come from and where we are headed. So join me in this short presentation. So first, I'll give you a look back at where we've come from in the last 5 years. We have completed the second strategic plan, the second CHS strategic plan. And in this strategic plan, we had six goals. The first goal was our health goal, focusing on optimal models for public health. Also growing our visibility and partnerships, growing our business, growing our people, research to action, and operational efficiency. From the successful completion of this strategic plan, a few highlights of the key achievements in the last strategic plan. In the second strategic plan, CHS was able to grow our footprint to the 47 counties in Kenya, implementing various interventions, HIV, TB especially in all 47 counties, and health system strengthening interventions as you've seen in the documentary. We have managed successfully cumulative funding just under $197 million US as a local organization. I think, echoing the sentiments from Dr. Maina from USAID, CHS has been a showcase of a local organization. To answer the question, can Kenyans manage large donor programs? I think if nothing else, CHS has blazed the trail for all other local organizations, and we hope that this continues. I think we've done our job in opening the doors for many others, and so we are proud to have been good stewards of all these $197 million US. In the time of the second strategic plan, we also implemented new systems. I think the foresight at that point has helped us at this critical time of COVID, because investments in systems that are technology enabled for our operations, like our enterprise resource planning system, reporting systems for programs, have enabled continuity even in this difficult time of COVID. And so we are proud of those investments at that time. That we have also expanded our programming to include new program areas within the second strategic plan. So we are proud of the achievements of that period. And in terms of numbers, people who have benefited from the services for TB, 344,000 Kenyans with drug-sensitive TB have been diagnosed and initiated on treatment. Just under 2,500 with drug-sensitive TB. And we have expanded diagnostics through GeneXpert to cover just under 190 GeneXpert machines across public facilities to support diagnosis for TB. We have also supported HIV interventions to ensure We've also supported HIV interventions to ensure over 4 million tests done in the period of the second strategic plan. We have identified over 100,000 Kenyans. It's not working. Over 100,000 Kenyans identified, 88,000 of those on antiretroviral treatment. testament to the work that has expanded from the initial 3 districts in central Kenya to working in 8 counties collaboratively with the county governments in the 8 counties for HIV services. And so we are proud to say today, as mentioned earlier by the country director CDC, that we support just about a quarter of the CDC portfolio for treatment, HIV treatment, and that's about 177,000 Kenyans benefiting from treatment services in collaboration with the counties that we support. In addition to this, we already embrace the era of, healthy communities where you empower the client. The client becomes an empowered member of the service delivery. And so taking treatment to the homes by initiating treatment through community groups, and we have over 2,700 of those with 24,000 patients already enrolled. We have also supported health system strengthening initiatives. 253 health facilities are now EMR sites, meaning they are using electronic medical records. And this, by the way, is about 17% of electronic or EMR sites within the HIV portfolio. Also disbursed 79 million as sub-grants to counties that we work with. We have also supported human resources for health, and supported renovations for 40 health facilities across the counties that we support in the second strategic plan. And so now we want to take this forward in this new period to demonstrate continuity, but also to be informed by the realities today. We know that today we have the reality of COVID. We know that today we have the reality of technology. How do we embrace the new technology that will come in the new strategic period? 5G, blockchain, artificial intelligence. All of these things will inform how any organization or any entity survives. Also, how do we embrace the new work environment? Work environment has changed. People are working from home. People are doing gigs. And so the new strategic plan envisions a different world that is informed by changes in the society, and this change is now established. So a glimpse of this. We have 5 goals. The first goal is our health goal. We continue with our main reason for being, which is health, public health solutions, and embracing an all-of-society approach through a healthy public view to using adaptive local evidence. This means we continue to put the client at the center of every solution that we introduce, every solution that we collaboratively implement with government. We'll have the client at the center. I don't think we ever imagined a time when your first public health official is the watchman who welcomes you to any institution. This goal recognizes exactly that health is now a responsibility of all of us. It's not just a responsibility of health personnel, it's an all-of-society approach. And that's what this goal is about. It has a couple of objectives. We want to continue being the preferred partner in sustainable health models. We want to implement resilient, integrative health systems to address existing and emerging health needs. We know that new health needs keep emerging. We have seen from COVID. And so we want to remain resilient, but to ensure that this is done in a client-centered approach. Number 3, to position the organization in health research, particularly implementation research, and to continue global health security initiatives, because it's our collective responsibility to ensure health security for all. And finally, to adopt technology-enabled solutions in program design, implementation, and monitoring. A couple of key innovations from this first goal. We are launching the CHS South to South Technical Assistance Initiative, We believe that over the 10 years, we have learnt a lot. We want to be a resource to newer local organizations, to work with them, to enable them grow and pass the baton to them. And essentially, that's what the South to South Technical Initiative is, aimed at building capacity of local public health entities to support the growth of local capacity in public health. The second initiative is a County Technical Support Initiative. We know that counties are empowered with the implementation of health services. We know that counties continue being the focus for implementation of services, and we would like to remain a resource to counties as they take on more responsibilities, particularly in implementing these broad programs that have been supported by local organizations. We are a resource to work together to ensure donor resources are managed well, to ensure resources are used and applied for impact. And that's why we are excited about this new County Technical Support Initiative. Also a new public health initiative, keeping tabs of the changing public health. We know new pathogens will keep emerging, even in the period of the third strategic plan. We would like to remain resilient, and we would like to respond appropriately as this happens. To grow our research hub, so to do a bit more implementation research, and also e-health initiatives to support our health responses. The second goal is our people goal. We have grown our people before, but now we are reimagining what would it mean to work with people in the organization in this new era. We are foreseeing working with an engaged, inspired, multi-competent team in a flexible work environment. We are recognizing that a couple of things have changed in the workplace, and this strategy embraces that for the future. So a couple of objectives. We know that the flexible work arrangement is something that will continue in the foreseeable future, and so we are prepared for this new novel future work environment to promote a culture of innovation. I think we have already demonstrated that in our second strategic plan, and this is what we intend to continue through multi-competent, inspired, and passionate individuals. And also to retain our best. We have been fortunate to retain some of our best talent. We know others have gone elsewhere, but that remains our endeavor, to retain the best and to engage our teams in positioning CHS as a brand. The third goal is a technology goal. We know that technology now is ubiquitous, and it has grown especially post-COVID. So what we intend in this goal is to optimize adaptable, responsive, innovative technology for operational and program excellence. The objectives for this: we have had systems both at the organization and at our program level. What we want to now do is to ensure a one-stop, automated, decentralized, interoperable system to enhance business, actually guided by business intelligence. So we think from the foundation we have, this is really the next step to make sure we are able, at any point, to use the benefits of the technologies such as artificial intelligence. We want to be responsive to emerging market needs, and we want to establish a robust security framework, because we know with technology, you must invest also in technologies, in security. We already have the foundation for this, and we believe that in this new strategic period, this will be a reality. We have set up a technology team of experts to support this goal, a technology hub for the organization, and utilization of the new technology, especially blockchain, in document management for the organization. The fourth goal is our social impact goal. We want to leverage our brand positioning for impact. We've already demonstrated impact in our large public health programs, but we want to continue leveraging this by positioning the brand as such. Human interest stories. We are keen to listen to our clients and our beneficiaries. And this is what we intend to do, to continue doing for social impact. Brand story. We've already demonstrated this in what you've seen before, and we intend to use this to push our brand even further, and to use our brand credibility to promote strategic partnerships and brand ambassadorship from our team, and you'll see a bit more of this in the next session. So, social impact innovations, to continue positioning CHS as a thought leader in health, and to grow our brand story. Next goal is a business goal. To grow our current business and develop social enterprise through innovative approaches. You have probably heard, have I done? Yeah. So you've heard before about the need for self-reliance. It's been discussed by both representatives from our donors. So we would like to harness the opportunities for our current business model for continued growth, for what we've already been doing, but also a new social enterprise vehicle, which is a CHS Institute that we recently launched for social enterprise. And the CHS Institute team, I will ask the business development manager to stand, Joseph, because through the CHS Institute, thank you, Joseph, we'll be reaching out to translate our innovations to the marketplace. We have been privileged to come up with different innovations through our programming, but for the sake of sustainability, we need to translate this into the marketplace, and so Joseph will be knocking at your doors in the future to support this. CHS has a few assets that we have grown over the last 10 years, totaling about $430,000. We envision that in this new strategic plan, we grow this to $1 million for the sustainability of the organization. And through the Institute, we will have about 8 innovative public health packages that will be launched from the last part of 2021 through 2025 to support the social enterprise component. And so the key innovation in this new goal is CHS as a social enterprise through the CHS Institute. And that is it. So we look forward to this new period. We look forward to your support. We thank you for all the support we've had in the first 2 strategic periods, and we're truly excited about what the future has in this new strategic period. Thank you very much.
Thank you so much indeed. Another beautiful round of applause. Asante sana, Dr. Paul Wekesa, thank you so much. So yes, celebrating 10 years, but also ushering in a new era of work through the strategic plan. And just before we move to now witnessing the symbolic launch of the strategic plan, ladies and gentlemen, CHS, as a local not-for-profit organization, utilizes 100% local expertise as well as strategic partnerships to implement evidence-informed solutions and interventions to existing and emerging public health concerns, and to help us envision the future. And also later on, welcome our chief guest. Ladies and gentlemen, please welcome Board Chair, Dr. Richard Aya. A big round of applause, please. Karibu sana.
Oh, no, go ahead. Is the mic working? Good morning, everyone. Is the mic working there? Our chief guest, the Deputy Governor of Makueni, our partners, our collaborators, and the CHS family, good morning. Now, I'm privileged to stand before you to just say one or two things and invite the chief guest. I'm one of those very lucky people to have with me such a wonderful team. So the presentation you just got from Dr. Paul Wekesa, I'm sure you'll appreciate that a lot has gone into it. And it's the kind of thing that gives you a lot of joy when you're part of such a great team. Now, as part of the 10th anniversary, I was just reflecting, I wonder how many of you can remember last year, somewhere along the line in the middle of COVID, when it just started, and there was a total lockdown, and one of the images that came across was one where people were talking about that, oh, from Nairobi, you can even see Mount Kenya. Do you all remember that? And it was all so very clear in terms of what you could see and so on. And when you think about where we are today, and we still have to continue wearing the masks and so on, I'm a little sad in that sense that there's some things we can't see. And one of the things that you can't see is that I am bursting with pride and joy standing before you here at this 10th anniversary. So you just have to take it from me that under this mask, I am so happy to stand before you. It's kind of like that image of Mount Kenya. Now, there's a thing we talk about in health, and particularly public health, and it's something that I don't quite agree with. And it's that word called challenge. People say, we have challenges, to solve, we have challenges. I don't quite think that we have challenges. I think that challenges are like that Mount Kenya. It's there, whether you see it or not. Don't really mind what's going on in Mount Kenya. It's okay, you carry on with your life. But if you decide you want to climb it, then it becomes a challenge. And you climb it, and it's no longer a challenge for you. Then it becomes a challenge for somebody else. I think what we have in public health are problems. And problems are things that come about because of the way we build our society. And CHS is about solving problems. And so we get the problems, we find solutions, and then the problem is solved. So you come tomorrow, and you cannot believe that there once was a problem. So when we're discussing about having a celebration, sometimes you can think, well, why do you want to be so self-congratulatory? Why do you want to mark the 10 years that have passed? Because after all, the problems have been solved. The reason for that is that we need people to realize that in building a better society, we have solved certain problems. Now, I'm very lucky that I served on the board with Dr. Mandalia, who was the first chair. And he started practicing at a time when HIV was really raging. Today, you don't have to die from HIV. It's something, problems have been solved. And part of the solution of those problems has been CHS. In the earlier days, 3 months or so, you'd have HIV, you'd be dead. That's not the case. So if you come into the world today, that problem is gone. So we have to keep on reflecting on that CHS, and I'm sure that all of us know why CHS exists, that's the solution part. The fact that we identify problems and we solve them, and we'll continue to do so. Now, the bit I wanted to talk about a little bit was the C part. The H, I think, is obvious. It's health. It's the C part, the center. If you just stand, please. Please just stand where you are. And you don't have to do anything, just stand. Okay, please sit. Now, I'm sure you started thinking, so why are we standing? That's the point. That's what the center is about. The center is for thinking. Because problems, relatively speaking, are easy to identify. How to solve the problems requires thinking. And so the center part of CHS is the thinking part. And as I look across, I see some familiar faces, I see some new faces, and I think to myself, these are brains. And as Dr. Paul said, we want to retain the best, and we have some of the best. These are the guys who think. So we're all thinking about the solutions and how we can make Kenya and the world at large a much better society. And it's not something that we take for granted that somebody is there that will solve some of these problems in society. So the center consists of two parts. One part of it are the implementers, and you've heard all the numbers that are there that show that something is happening. The other part of it is the governance. Now, when we think about Kenya as a country, we're always complaining, or the people I hang out with are always complaining about, we need to solve this, our governance, there's corruption, there's this, that, and the other. That's our society. Now, one of the things that we're very proud of is that $200 million later, or 20 billion shillings later, that money has been spent where it should be spent. Now, that tells you something about the governance of CHS. It is one thing that is unique to CHS, and it's something that we're proud of and something that we will continue to build, the governance. Now, governance, when it is good governance, you don't recognize it. So I hope that, not I hope, but I'm not the person you should be seeing every single day, because I'm part of the governance. So we're part of the people who support all the people who do the implementation, all the partners who work. So our job in terms of the board is to support the team that implements, to make sure that we have robust rules, that we have that environment that enables everyone else to work as well as they could. And I'm proud of that we have a very good governance structure in place. Now, I have to tell you a little story about feeling good and so on. So about a week ago, I was in my rural home, gone to do some farming and so on. For 2 or 3 reasons, got in quite late at night, and I just wanted to crash. So took a shower, got into the bedroom, and as I opened the bedroom door, and I happened to be alone in the house, so I opened the bedroom door. As I'm just about to get into bed, I noticed a little frog. A little frog entered the room with me. So I thought, gosh, now at night, it's like 10:30, what are you doing here? So I searched my memory in terms of stories of frogs and men, and I just couldn't find any. All the stories of frogs are frog and princess, frog and, So I wondered, so why are you here? So I believe in dialogue, so we had a brief discussion with the frog and said, look, we can't really sleep here together. Whatever you're doing, I think you need to leave. And the frog agreed, and I pushed it out of the door, and I slept, and that was it. The frog didn't make any noise, so I thought it had gone, however it had entered the house, and I thought that was that. The following morning, I get up, get together, and I want to walk on the farm, and I go, to the kitchen where I keep my outdoor shoes, and I start to put my foot in the shoe, and I feel like what? I left a sock in the shoe? What's going on? So there's this mushy thing inside. And I start to put my hand, and I feel this, And so I stop. It's like, this is not, no, I don't normally leave socks in the shoe anyway, so what am I thinking? So I shake the shoe, and there's the frog. And the frog swells up really big in the shoe. And I said, no, surely. We had a discussion yesterday, so why are you feeling like you should look so big to me? So I took the shoe and tossed it out of the door and said, look, house is mine, you stay outside. And I think sometimes pride is like that. We can sit and think about, like the frog, and think about being really proud and just thinking about the past, but there's the future. And if we don't build on what we have, we'll become like that frog that got tossed out of the door and we disappear. So I'm looking forward to building the next 5 years and beyond, and building a much stronger CHS together with all of you, our partners, and the CHS family as well. And so, as I invite the Chief Guest Deputy Governor to come and address us, it's just, we can be like the frog for now, at least for today, and swell up a little bit with pride, but to remember that we still need to build a way better society than what we have today. So thank you very much, and Chief Guest, Karibu.
Good morning. Are we celebrating? Yes, this is great. The CH Donor Center for Disease Control and Prevention, he spoke to us through Zoom. The USAID, Dr. Morris, also who spoke to us. Dr. Richard, the board chair, thank you very much for steering a very beautiful, very progressive organization. The CEO, proud of you, Dr. Paul Wekesa. With me, I have the CEO of the ECM, Dr. Muller, Makueni County, and all ECMs from other counties, the CEOs of the counties that CHS works for, the directors of health. With me, I have Dr. Ndolo, who is the Director of Health, Makueni County. And here, I want to say, we are very, very pleased to join you, the Center for Health Solution Kenya, as you celebrate your 10 years and launch the strategic plan for 2021-2025. That continues the service of the local people. And we saw the service from the documentary that you showed us. We saw smiling faces. We saw witnesses of people that have been touched by what you have done. So congratulations. So we are praying the next strategic plan will find space to actually address the present crisis that is facing the world, COVID-19. which is also an emerging health need. So we hope you will have space for that. For more than a decade, the United States Emergency Program, Aid Relief, through the U.S. Center for Disease Control and Prevention, has been working in partnership with the County Department of Health in Makueni County, by strengthening system towards delivery of sustainable health services. In support of devolved health functions, CDC, through its implementing partners, which is CHS, has a memorandum of understanding with Makueni County, which was signed in 2016. And since then, an investment of over 500 million has been made towards controlling HIV epidemic. In the current United States government financial year, we have received over 100 million shillings. This funding is channeled to the county through sub-grant jointly management, CHS and CHMT. Using the World Health Organization approach to health system strengthening, CHS has invested heavily in service delivery, health leadership and governance, human resource for health, health infrastructure and equipment, health information system, as well as health products and community security. Makueni County highlights for January 2021. Estimated HIV prevalence is 3.2%. Estimated number of people living with HIV is about 23,000. Adults are around 21,000. Children below the age of 15 is 1,597. Number of people on HIV antiretroviral treatments is over 18,000. Children over 1,579. Efficiency of treatment, viral supply percentage with satisfactory outcome, 93% of adults who are male, 92% of adults who are female, and 80% of children who are from 0 to 14 years. Number of supported health facilities in Makueni County is 68. Number of staff under the program is 139, and the categories are as follows. 10 mothers, lay workers who work with the people infected with HIV/AIDS. Clinical officers are 40. Health records officers are 13. Data clerks are 18. Accounts 2. HIV testing services and counseling are 40. HIV adherence counselors are 3. Laboratory technologists are 4. Nurses 12. Nutritionalists 2. And a pharmaceutical technologist 4. Key program areas that the organization focuses on CH supports Makueni County Health Department to implement and expand high-quality prevention, care, and treatment services across the 64 supported health facilities. Some of those services offered include HIV testing and counseling, integration of HIV/TB care and treatment services through standardized package of care, prevention and elimination of mother and child HIV transmission services, healthcare workers support capacity building through mentorship, instructive training, continuous professional development and on-job training, laboratory monitoring and pharmacy commodity management for the supply of antiretroviral drugs, lab sample transport networking, and many more. Equipment that we got support in, Center of Disease Control and Prevention, CDC, has invested $717,454 worthy of equipment. Some of the equipments are 20 binoculars, binocular microscopes, 5 laboratory biosafety cabinets, 28 computers, 9 refrigerators, and 84 stereoscopy, among others. Leadership and governance. Makueni County has demonstrated the ability to sustain the gains accruing from the partnership with CDC through the universal health access and commitment to absorb partner-supported staff into the county health workforce. So far, the county has demonstrated this commitment by creating HIV testing counselors and coordinators, a cadre with the County Public Service Board has ratified. We've got some innovations like use of motorbikes for sample transport, the sub-county HIV-led supervision model for the unsupported health facilities. So as Makueni County, we want to thank you and we want to celebrate with you the 10 years of service to this country, and we are praying that the next strategic plan will take us also, further in addressing issues of, particularly issues of HIV and AIDS, and issues of COVID-19, which we must face, that it is threatening our globe. And I know you will be innovative enough to actually start helping us to think through how do we deal with this issue of COVID-19. I want to say let's continue wearing masks, let's sanitize, and let's keep distance. Let's have less people in our meetings. But I think you should be telling me, because I'm a politician. We are the ones that are actually not keeping the rules. So thank you very much, and we are very, very proud of you. Asante.
Asante sana. Deputy Governor, Makueni County, Honorable Adeline Mwao. A big round of applause to our chief guest. Asante sana. Makofi nyingine tafadhali. Asante sana. Afrizo band. Ala. Twende.
Mpaka umechukua pose.
Twende mmoja nyingine mzuri. Sasa basi.
CHS tumemaliza miaka 10. CHS tuna celebrate 10 years. Waliona HIV wako na hope. Wana nini? Wako na hope. Wana nini? Wako na hope. Wana nini? Wako na hope. We also serve local community. Watu wale wa hapa wanapata daktari wa hapa madawa hapa sasa napokuja hapa una hope hapa.
Asante sana. Makofi nyingine tu Afrizo Band led by Helen Mtawali. Asante sana. Once again, please let us welcome the board chair. Board chair, karibu.
So it gives me great pleasure and it is an honor to formally invite our Chief Administrative Secretary, Ministry of Health, Dr. Mwangangi, to give her remarks on this, our 10th anniversary. Now, as she comes up, you know, one of the things that Dr. Paul Wekesa presented was talking about how CHS has grown from just one county, the small sort of few counties, and then he said to all 47 counties. Now, what he didn't say, and I guess he assumed, was that all those 47 counties equals Kenya. So CHS is actually working throughout Kenya. And so that's why it's really important that we have the cast with us to represent the Ministry of Health, which has oversight over all functions of health within the country. Daktari, karibu.
Ungeweza ungecheza kasalsa wewe. Daktari, wacha tumalize. Wacha tumalize.
Thank you. Thank you. This is a good way to start the weekend, indeed. Thank you so much for inviting us, the Ministry of Health, to grace this occasion, celebrating the work that CHS has done. Thank you so much also for observing the COVID protocols. I think it becomes important for me to continue to remind us all that the situation is a bit dire in the country. I'm just from Kenyatta National Hospital, that's why I'm late. And in Kenyatta National Hospital, we have close to 24 staff who are admitted now on oxygen. So the situation is dire. And we need to be careful, we need to continue observing the protocols, continue masking, continue sanitizing, continue washing your hands. But perhaps even also important is continue celebrating the work that CHS is doing, because it forms an important cog in ensuring some of our vulnerable members in this community are also protected, continue to get care, with very minimal disruptions in this new age of COVID-19. And so that is why we are here as a ministry, because we believe in what you're doing, we celebrate what you're doing, and we want you to continue doing what you're doing. I'm pleased especially to be here with my mother. When I came in, I asked her, have you been doing good? And she was doing a little negotiation with me, telling me we can go right now and get that job. It's very, very important. When the time comes and we are onboarding those over 50 years, those with chronic conditions, we really require you, CHS, to go beyond your mandate of HIV and TB and sensitize your groups, those communities that you work with, particularly the cohorts that you work with, to present themselves and come forward. And so allow me to read the speech of the Cabinet Secretary. I'm here by delegation. And he says that the Center for Health Solutions, CHS in Kenya, has been a trusted partner of the Ministry of Health since the organization's inception in 2010, and has been offering supportive functions in HIV/AIDS, TB management, such as laboratory pharmacy systems, monitoring, evaluation, human resources for health, healthcare financing, leadership, and governance. And the Ministry of Health appreciates these efforts graciously. ladies and gentlemen, Kenya committed to the UN AIDS 95 targets to fast track and accelerate action to end the AIDS epidemic by 2030. To attain this, we know that we must work hard to sustain HIV prevention efforts because they play a key role in controlling HIV and TB. And our success indeed is pegged on close collaboration and coordination between service providers, ourselves, our communities, and our patients. And this can only be possible through continued collaborative efforts between the Ministry of Health, key stakeholders such as the county government of Makueni, which is here present today, partners, developmental agencies, as well as implementing partners such as CHS. I'm sure we're all aware that we're in the throes of what we're calling a double pandemic. We're still battling infectious diseases, NCDs are creeping up, and now we have COVID-19. And so this pandemic continues to test the resilience of our health systems, and I'm happy to note that implementation of guidance issued by Ministry of Health in the advent of COVID-19 has been well executed. And these guidelines have ensured minimal disruption of services for people living with HIV and TB. And I do commend CHS and other partners who have continued to support the country at this critical time. When I was coming here, I was quickly appraised of some of the work that CHS has been doing, the targets that they've met, some of the innovative ways that they've been able to respond due to the COVID-19 disruptions, to the point where we are asking ourselves, is this the time where perhaps we allow multi-dispensing of drugs and commodities for our patients as opposed to having them coming in every other month to the facilities? And perhaps, and I was asking the lady who received me, doesn't this mean that we need to continue with this as the norm then going forward? Identify those who are nearly suppressed in terms of viral loads and give them their medication. Lessen the workload for our healthcare workers, ensure we have good surveillance mechanisms to monitor them when they're at home, and move in this sort of new, efficient, disruptive way of COVID-19. And so I do thank CHS for showing us that it is possible to have that mechanism. And so at this juncture, really, it is to appreciate you all for being partners, for collaborating with the ministry. One of the key things that Waziri wanted me to mention is the issue of local manufacturing. I know you're an implementing agency, but one of the things we want you to champion, particularly when it comes to HIV and TB programs, is the local manufacturing of commodities that, one, promote our local economy here, that promote our industries, but also, in the age of COVID-19, perhaps teach us what is called self-reliance. Many of you may not know, but last year, we actually had resources available in Exchequer, but we struggled to get commodities in the country. And that therefore served as a big lesson for us, that you can have the resources available, but you will not have those commodities because you're relying on other people to avail them for you. And so in this regard, we're aware MOH put in place allocations of close to 1.2 billion for the purchase of cotrimoxazole for people living with HIV and AIDS. And we are proud to announce that now we've identified local manufacturing companies that will have the capacity to manufacture this commodity, therefore avoiding stockouts and reducing the costs that are spent on importation of this important drug. And this is an area really that we'll continue to look at to ensure that we facilitate those critical ART commodities to ensure that they're available for our community. And so I thank you so much for your collaboration. We continue to encourage it, we continue to welcome it. We also remain available for any game-changing, innovative ideas, such as those that have been implemented by CHS, for adoption in the ministry and for scaling up such interventions. Thank you so much for your time and your attention. I think I'll hand over back to the MC.
Thank you so much, Daktari. Asante sana. Thank you for your time. Asante sana. And before you leave, we have something very very special that will be facilitated by the board chair. Board chair, makofi yake tafadhali.
Thank you very much. I think another round of applause for Dr. Mwangangi. Now, one of the tips I'm hoping to get, if I just get like 30 seconds with the Chief Administrative Secretary, is that you know how you keep on spraying your hands with this stuff? And then your skin now starts to look all dry and stuff. So there's a little secret I'd like to get. Now, it's my pleasure would like to just give some tokens of appreciation to our chief guests. So I'll invite Dr. Paul Wekesa to come up as well, and then invite the Deputy Governor and the Chief Administrative Secretary to also come up so that we can give them a token of appreciation just before we officially launch. So.
Big round of applause to our guests, our chief guests, Asanteni Sana. We want to honor Honorable Deputy Governor Asante Sana.
Yes,
The awards are ready, please.
Yes.
Exactly.
Yeah.
Exactly.
So,
And immediately after that, ladies and gentlemen, we will witness the symbolic launch of the strategic plan as we celebrate 10 years of service to local communities. Makofi out of that. Afriso band. Twende kazi.
Wanapata zawadi, zawadi, zawadi. Wanapata awards, awards.
The first award is for the Ministry of Health. Ministry of Health Award.
you will call.
Makofi to Ministry of Health.
Yes.
Makofi out of that.
This is from us. Thank you so much for coming. We'll give it to them to pack later on. Yeah. So these ones you can give, and when you give other people gifts, you
Makueni County Government.
want to officially open.
Asante Sana.
So you want to officially open.
And now, ladies and gentlemen, we are ready for the launch.
Take this so far. Until afterwards. After
Now we want to unveil we are ready and we will have a countdown. Now, ladies and gentlemen, onto our countdown. Onto our countdown.
10, 9, 8, 7, 6, 5, 4, 3.
Ladies and gentlemen,
0.
a standing ovation, ladies and gentlemen. Let us all be upstanding. Makofi tafadhali, celebrating 10 years of service to local communities. Whoa! Asante Sana, the CHS Strategic Plan 2021 to 2025. Hey! Hey! Miaka kumi! Asante Sana. Thank you so much. We now stand and take a photo. A beautiful photo to remember, of course. Asante Sana. Makofi nyingine tafadhali. Asante Sana. Then let's go the 10 years. 10 years side. Fantastic, fantastic. Well done. 10 years. nyingine tafadhali. 10 years, 10 years. Asante sana. Tuko na keki.
Kuna keki.
Haya. Ya kusherehekea miaka 10. Haya. Wewe. Wewe.
Ninakuja keki. Keki
Haya.
Keki ya CHS iko mbele yetu. Keki ya CHS tutakata leo. Kata. Tunangoja kukata. Tunangoja kuikata. Keki ya lochike. Tunangoja kukata.
We're now ready to cut the cake, and I'd call upon Board Chair, CEO, once again, CAS Karibu Sana, and our chief guest, Deputy Governor Karibuni Tena, tuweze kukata keki.
The sweet part, eh?
Naam, hatutakata, tutasimama tu kando kidogo tuweze kupiga picha kwanza.
Okay.
Halafu baadaye kila mmoja wetu ataweza kupata kipande chake cha kusherehekea siku ya leo.
Tunangoja keki.
Haya.
Keki.
Wewe. Nakwambia.
Tunangoja keki. Hiyo keki tamu.
Wow.
Kwanza tupige picha.
Tupige picha. Picha.
Kwanza tupige picha na hiyo keki tamu. Hiyo keki ni kubwa. Hiyo keki ni kubwa. Hiyo keki tamu. Hii keki ni ya lunch.
Asante sana.
Pia ni ya anniversary. Hii keki ni anniversary. Hiyo keki tamu. Tunangoja kula. Tunangoja kula. Hiyo keki tamu. Hakikisha ukate kubwa.
Asante sana. Thank you so much. We will be served, but very quickly, because of time, we want to move on to that place where we want to celebrate by giving awards of service to long-serving staff and friends of CHS. And we'll start with the first category. And Board Chair, please, I'd kindly request that you come in front once again and help us in giving these awards. Aya, tuko tayari. The first presentation award to friend of CHS, Professor Jane Carter. Professor Jane Carter, makofi yake tafadhali. She is not here, but in absentia, in appreciation of your commitment to excellence, heart of service, and invaluable support in the CHS. Dr. Brenda, picking the award on her behalf. Thank you so much indeed. Nashukuru sana. Thank you so much. Makofi tafadhali in absentia. Second award.
Congratulations.
To Simon Mureithi, Finance Manager. Simon. Makofi yake tafadhali anapofika. Haya, twende.
Lord, I'm giving you a big hand. Well, congratulations.
Asante Bwana Chair, makofi ya Bwana Chair. Thank you so much indeed. Asante. Next person to facilitate the giving of the award, please. Bwana George Opio Britam, Head of Group and Credit Life Sales. Bwana George Opio, uko wapi? Makofi yake tafadhali, makofi yake tafadhali. Asante sana. Haya. Presentation of one award to Stephen Nganga, Administration Officer. Uko wapi? Makofi yake tafadhali. Asante sana Stephen Nganga. Asante sana. Asante sana. Thank you so much, Bwana George. Asante sana. Next online, I'd kindly call Dr. Mercy Mwangangi once again, karibu sana, to help us give this award to Bwana George Odondi, Finance and Administration Director. Karibu sana. Asante sana. Makofi yao. Makofi. Asante sana. George Odondi, Finance and Administration Director. Thank you so much, Daktari. And finally, ladies and gentlemen, I welcome Honorable Adeline Mwao, Deputy Governor, Makueni County. Makofi yake tafadhali as she comes, presenting this one award. This award goes to none other than Dr. Paul Wekesa, Chief Executive Officer. Makofi yake tafadhali. Haya. Kila mtu tusimame. Haya. Mbele kidogo. Chair, karibu. Bwana CEO, Deputy Governor, CHS, tafadhali njoeni mbele kidogo. Bwana Odondi nawe pia karibu. Final photo session there. Asante sana. Makofi out to the team. Makofi out of that. Asante sana. Asante sana. Thank you so much. Thank you so much. Thank you so much indeed for your patience and for being part of this journey. And now, ladies and gentlemen, we want to close. It has been a journey, and we want to celebrate all of you for being part of that journey. And to give us the closing remarks, please put your hands together. Put Apollo, Chair, Audit, Risk Committee. Karibu sana.
Good morning.
Chief Administrative Secretary, Dr. Mercy Mwangangi, Your Excellency, Deputy Governor, Honorable Adelina Mao, thank you very much, Chair of the Board, and all other distinguished guests that have been invited here, both present and on Zoom, because we know some of them have joined us and still with us on Zoom. Good morning. I just want to take this opportunity to express a vote of thanks to several people, but first of all to express a significant vote of thanks to God himself. It has been a long 10-year journey for CHS. The first step was walked with God. The 10 subsequent annual steps were also walked with God. So I just want to start by thanking God Almighty for taking us this far as an organization and in the manner that we have impacted the communities that we serve. Secondly, I want to thank the government of Kenya, represented here very ably by the CAS, Dr. Mwangangi. Thank you very much. The journey would not have been as successful as it has been without the support of the government. In fact, in your remarks, you've come out very, very clearly that there is a strong partnership that CSS has engaged with the government of Kenya in facilitating the impact of the programs throughout the country. So thank you very much as government in facilitating that journey and also in committing to share the strategic direction that we're taking in the next 5 years that was presented and will be shared with your team. So thank you very much, GOK. I would also want to thank the county governments, especially Your Excellency, our chief guest today, Honorable Mao. Thank you very much. While I was sitting with you earlier, you said, I heard you whisper that you said you are here at 6 a.m. in the morning. So that was a very strong commitment from your part. So thank you very much. Thank you for representing the county engagement with CHS. We very appreciate it. We don't take a lot of those things for granted. As you notice, we are in 47 countries, and Makueni is a significant player in our engagement with county. So thank you, and thank you very much. I also want to thank our people, the chief executive and his team, and all the people that have ably realized the vision innovatively in realizing some of the different ways that we have managed to reach out into our communities in the programs that we have implemented. So thank you very much, Paul, and your team. I know it's a big team. It's difficult to drive diverse people, diverse qualifications, but sitting as a member of the board appreciates how you've guided the team, especially when we had to just look at cutting down some numbers last year because of COVID. And I think that was managed very well from your desk. I would also want to thank our donors. It wouldn't have happened without the donors. The 196 million that we've cumulatively managed up to 2020 last year has all come from donors, and significantly from CDC and also from USAID. So thank you very much. The donors who are represented here, and I know some of them are still on Zoom, so thank you very much. Finally, let me just thank the vision. Right from the beginning 10 years ago. I joined this board about 8 years ago, and I could see where it was going. But there was a vision around it. Dr. Mandalia, we heard his presentation, and the people who've been part of the process and part of the journey. I really want to thank them, but critically to also call upon their support, even if they are not actively engaged with the activities of CHS, call upon their support to take the organization forward through to the next 5 years and beyond. So thank you very much. Thank you for those who've managed to come here, those present. I know it's challenging to be able to attend physical events like these ones, but thank you for taking courage and thank you for participating. Really appreciate. God bless you, and have a good day and have a very good weekend. Thank you very much.
Thank you so much indeed, Kotsotolo. We've come to the end of, yes, furlong, celebrating 10 years of service to local communities, but of course starting another journey of working towards creating that responsibility that all of us must be part of creating that health security we need. All right, as we close, we want to celebrate our sponsors. And we start with Safaricom. Makofi ya Safaricom, tafadhali. Well, Rita, makofi out over there. Haya, tuko na Sherehes, Image Plus, Ras Others Limited, Hardwood Furnitures, Artmark Enterprises Limited, Jillian Hotel. Asanteni sana, God bless you. Big time, all the best. Asanteni sana. Thank you so much. Abrizo Mungu wape. Twende. Asante sana. And to all the county teams, thank you so much for coming. Please remain behind for a moment. All the county teams, asanteni sana. Afrizo, all the county teams, please come in front. Please come in front, all the county teams. Karibuni, asanteni sana. All the county teams, please come forward. Makueni CHMT. Muko wapi? Asanteni sana kwa kuja Machakos. Njooni.
Melody and love pichengu chenge good Seneza miluka kapi chengu Manafala ya love pichengu chenge good Seneza miluka kapi chengu Melody and love pichengu chenge good Seneza miluka kapi chengu Ya love pichengu chenge good Seneza miluka kapi chengu Aliperi kapi chengu Everybody knows, everybody knows, everybody knows, everybody knows, everybody knows, we are a free zone, everybody knows, we are a free zone, this music is produced from the same past. Everybody knows, music is produced from the same part, everybody knows, this music is produced from the same part, everybody knows.
Nyandarua County, please. CHS team members, please come forward for a photo session. CHS team members, please come forward. CHS team members, please come forward.
Hey,